If you have shoulder pain, this video will give you the tools you need to give yourself a self-massage with your own hands, to relieve both the pain in the back of your shoulder and that annoying pain that is located right in the front part of your arm. We'll focus on deep muscles such as the Supraspinatus, Infraspinatus, Teres muscles on the edge, and the Suprascapular, a very deep muscle that is between the scapula and your ribs. If we remove the muscles, we're left with a thin scapula like this, where we find certain structures that we will locate on our body in a moment. Just remember this: spine of the scapula, medial border near the ribs, and lateral border near the armpit. Get some cream, get 2 cushions, a mat to lie on, and a lot of motivation. Begin the massage by lying down and exposing the shoulder to be treated. We're going to place the smaller pillow right under the head to be comfortable, since we'll be in this position for quite a while. With your opposite hand, I want you to identify certain parts, anatomical structures of your scapula. Pay close attention, Marcos Sacristan. I'm going to rest it on the floor. My right hand goes under my armpit. We're going to find the scapula here, like a triangle that runs from the top of your trapezius to the top. We have the lower edge of the triangle. Right here, with a small shadow, runs the entire medial border, meaning that from here to the spine, we only have muscle. Medial border, inferior border. Here we have its lateral border, and when we go up and reach the shoulder, we see a small shadow at this level. This is simply the spine I just mentioned. Basically, what it does is divide the scapula into 2 parts, the supraspinous part and the infraspinous part. Take your time, okay? It can be a bit tricky to find all of this at first, and you might not get it right the first time, but that's okay. The more you try, the better you'll find it. Keep in mind the idea of the medial border of the scapula, its inferior border, the very simple lateral border, and at the top, right where the trapezius ends. We have that spine of the scapula that runs from the center outward. In this position, it's sometimes harder to find the scapula, but in a more neutral position like this, it's easier. Look. Here we can touch that spine of the scapula very easily. Soft, 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 soft. Here it's hard, which means we're on the spine of the scapula. The medial part here is harder to touch, but the upper part is much easier. And it's important to locate it because we're going to start treating the infraspinatus, which is below the spine, and then the supraspinatus, which is just above it. I place my hand in front again, my left hand. Now I want to position my hand like a claw. I want you to reach as far back as possible with your fingers. You might go past the medial border, but that's okay. From here, I want you to move your hand like a claw, dragging that muscle outward. We place your fingers below the spine, and we slowly drag those fingers toward the armpit. 2. We also need to go over the muscle from the medial edge. I pull steadily with my fingers, keeping firm pressure. 3. Up to at least 10 passes. We can apply a little bit of cream if your skin is more sensitive. 4. Or if you slide worse over the muscle. We slide. 5. Let's do it a couple more times. I squeeze tightly. I slide my muscles with my fingers. 6, again, I go back, I press and pull outward. 7, one more, I press hard, I slide, 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 and 8, very good. This way we are working through all that infraspinatus muscle below the spine. Is it common to find a painful spot when massaging your shoulder muscles? Maybe when you go over it, it causes a bit more pain, or causes referred pain. The infraspinatus can also cause referred pain in the front of the shoulder. What we're going to do here is place the index finger and middle finger one on top of the other, and we're going to scan that muscle looking for tender spots where there's pressure or discomfort when palpated. We're going to look for it always within the limits of the inner border, outer border, and the spine of the scapula. When you find the trigger point, press it lightly as much as you can. When you press it, you'll notice increased symptoms, more shoulder pain, and more pain at the pressure point. It's okay, that's completely normal. We keep the pressure for about 40 seconds and then relax. Are your fingers getting tired? Well, you can use your middle finger, your ring finger, all the ones you can. Really, the important thing is that you apply constant pressure for 40 seconds After finishing that spot, we continue exploring, and if we find another trigger point, we press it with our fingers again. It might cause some discomfort at first, but as time goes by and we notice more that that pressure relaxes the muscle, those symptoms should decrease. If it's hard for you to apply that pressure, what we can also do is place another cushion above your head. Put your arm over that cushion so it's fully supported. As you can see, we can now more easily recognize several structures here, like the inner edge. See? The spine of the scapula comes out to here, and here we could apply some pressure to the infraspinatus muscle. However, I advise against it. If you can do it normally, do so, since putting your shoulder in that position may increase muscle activity and make squeezing harder. Placing your hand in front, supported by the palm, is usually very effective and relaxes the muscle. We've done a first technique of muscle passes, a second technique of pressure on trigger points, and now we're going to move on to the supraspinatus area. Remember that we can work right up here for the supraspinatus. Yes, I suggest placing the pillow beside you to fully relax your arm. We remember where that spine is, the upper part of the spine, the scapula. And from here, what we're going to do first is a glide similar to what we did before. The supraspinous fossa is a fossa, indicating it contains deep muscles. Therefore, we're going to press those fingers in right there, just at the level of that supraspinous spine, the spine of the scapula. And from here, we're going to pull outward, toward the shoulder, as if we wanted to go along the entire supraspinous fossa. Support, step, step, step. Relax. Do this until you've done 8 or 10 sliding techniques. If a technique causes skin discomfort, you can apply a little cream or oil. That will help everything slide more easily and make the sensations more pleasant. Let's do a couple more. If it's very hard for you because your right arm gets tired, which can happen, you can also ask someone else for help. From this very accessible position, we press and move outward. Let's do a couple more. Last repetition. I press and push outward. Does the same thing occur with the supraspinatus as with the infraspinatus, like areas of more tension or sensitivity? For that, to work on them, we have to once again place our index finger above the heart, press and hold the position for 30 to 40 seconds. You need to find an irritated, sensitive, uncomfortable spot. Notice how, as we keep applying pressure, we gradually feel less pain. Gradually, we feel the muscle loosen under our fingers as we work along it. We can also work slightly on the outside. A little bit outward we also press, and always for 30 to 40 seconds, at least 30, so that the muscle ends up relaxing from the medial edge outward. This with the gliding movements and with the pressure point, pressing firmly against that sensitive spot for 40 seconds. We worked on the infraspinatus and supraspinatus and mentioned this at the start of the video. The teres muscles are slightly rounder muscles, located between the lateral border of the scapula and the shoulder. And they have a very, very important function in all pulling movements. For example, pulling anything towards you, doing pull-ups, rowing, or doing lat pull-downs. To work on it, I'll turn a bit more to the side, and we'll position our hands like a clamp. Not sure if you can see, so take a good look. I want my thumb to be inside that scapula and my fingers to be on the outside, in such a way that the muscle mass that attaches right at the shoulder is between them. What I want to do from here is close those fingers, pull outward slowly, trying to separate the muscles. When I feel it slipping or my muscles are giving out, I slowly loosen my grip. Basically, I grab, apply pressure, and keep pulling, 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 and then I relax. I grab, apply pressure, keep pulling, 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 and then I relax. And like that, about 10 times. I insert my thumb well into my armpit, put my fingers in, pull outward, 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 and here I can already feel it slipping away. I relax. I take my fingers, insert my thumb well, put my fingers in, relax, 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 pull outward, and little by little I let go of my hand. It's more uncomfortable. It's a more demanding technique that aims to work all those muscles well. And these muscles usually cause discomfort in the arm. Right now I'm doing it and I feel discomfort on the outer edge and inside my arm. I rest my thumb, I rest those fingers, I apply pressure and pull outward. I rest my fingers, pressure, pull outward. I rest my fingers, pressure, pull outward. And we continue. Fingers, pressure, pull outward. We've done 4, let's do a couple more. Pull outward. One more, pull outward. And one more, pull outward. Very good. Relax that arm. Take a moment to feel how you've worked all those muscles. Let's do a quick review of what we've already seen. I've used my shoulder for that. Just imagine it's here. It's basically the same. We've done some work. Let me grab it with the other arm. Let's see if it stays there. We've done some work on the infraspinatus, using our fingers, placing that arm in front. We've worked on the supraspinatus with our fingers above that iliac fossa. We've also worked on the teres muscles, which are in this area, though you can't see them here since the arm isn't separated. These are the muscles we have here, and we've worked on them using a pinching exercise. Now I'm going to turn around and we're going to work. The subscapular muscles are muscles that are attached to the inside of the scapula, between the shoulder blade, that scapula, and the rib cage. So we turn around and then we finish. Due to the head muscles, the biceps tendon often causes significant discomfort at this level. As we already explained, the subscapular muscles are located between the scapula and the rib cage. Therefore, to access it, we have to insert our fingers right there in the armpit, very, very deep. I recommend doing it with your thumb. Make sure that what you insert is your thumb all the way to the bottom of the armpit, and that the rest of your fingers go around behind that impressive muscle mass we have in our back. Now move your thumb inward and downward, okay? As if you wanted to reach your spine. Hold the fingers above and the thumb below for better results. Then I insert my thumb backward until I feel a wall. It's actually an unpleasant sensation. Once you feel that wall, just hold the position as we did before with the infraspinatus and supraspinatus. These fingers back here will give you an extra point of support and a wall so you can generate more force with your fingers. And we hold the position. Ideally, you should do it with your arm more over here, okay? More horizontally, but so you can see it more clearly, I decided to put it up here, okay? But basically, your elbow should be in front of your shoulder, okay? We hold the position. Place these fingers, hold it and breathe. For how long? About 30 to 40 seconds would be ideal. You can do several sets if you want. And when you finish, you'll notice, above all, a feeling of relaxation in your shoulder. A looser shoulder, okay? If you can't recreate that unpleasant or electric-like feeling in your shoulder, your thumb isn't positioned correctly. Notice that what I'm doing is moving my thumb down and inward, as if I wanted to touch my spine with it, okay? As if I wanted to touch that spine. Are you noticing that? It's essential for properly applying the pressure. Let's choose 10 more seconds. And rest, and pay close attention to where I'm placing that thumb at the bottom of my armpit. I'm trying to move it down, and also back toward my spine. Okay, arm just in front, and we work on it for 30 to 40 seconds several times. Very good. Now let's move on to the biceps muscles. Sit on the floor close to the couch, because for this last technique, we're going to need your arm to rest on the couch. We'll focus on the biceps muscle. It's a muscle that runs from the elbow to the shoulder, but at the end it splits into two heads, the long head and the short head. The interesting thing about this is that the long head inserts at the top of the shoulder joint. Therefore, there is a huge connection between the biceps and the shoulder. In fact, many of the pains that appear in the front part of the shoulder are due to problems with the long head of the biceps, especially if you lift weights frequently. Our biceps are here, a muscle at the front of the arm that shortens when we bend the elbow. At this level, if I contract, you'll notice a groove here. You can easily see it. This marks the division between the long and short heads of the two muscles. The short head reaches the coracoid process, while the long head runs more vertically. So, I simply recommend that you don't do this, but instead find the boundary between the deltoid and the biceps. Basically, the deltoid is this muscle that's above our shoulder, protecting all the rotator cuff muscles. As you can see, there's a large deltoid V. We'll be touching exactly at that level. We find that level where the biceps is differentiated from the deltoid. We place our fingers a little higher, slightly above, slightly to the side, above this long head of the biceps. And from here, what we have to do is, while you place your index finger below the heart, make back and forth movements inward and outward, without letting the skin slide. I'm resting on my skin and moving everything underneath, but I'm not rubbing my fingers on the skin. See the difference? This is wrong, which we did before. I press hard, this is right. Here there's no rubbing, I don't hear anything when I move it. But here, I hear how my fingers rub against the skin and make a sound. I don't want it to make a sound. Alright, rest those fingers, stand up straight, rest your head against the wall if you can, and work. Back and forth, left, right, up, down. Not just left, right, in, out, but also up and down. And try a little lower, and let's work. This area causes more discomfort. so we'll focus more on that tendon, a bit higher. I don't feel anything here, so I'm going to focus more on the lower part, which is more sensitive. How long should we work on it? Well, about a minute would be fine, which together with everything we've done will be around 10 minutes. Doing 2 or 3 1-minute sets is ideal. Great technique and sensations. Here I'm going down a little more, very close to that long head, remember? Highly effective for anterior shoulder pain. Very good. This was the last technique I had to teach you. You know that if you liked it, you can subscribe to my newsletter. An email that I send every Sunday with all the frequent videos I release during the week. Basically, you click on that link that appears up here, leave your email, and you get immediate access to the newsletter, which is completely free. Plus, I have a library of over 1,000 videos collected over the past 14 years. I hope you like this. We've worked on and massaged the Infraspinatus, the Supraspinatus. Let's remember them here. We've worked on and massaged the Infraspinatus, which was just below the spine. Very important in anterior shoulder pain, also the Supraspinatus, just above the spine. Afterwards, we worked on the Teres muscles, the small, more independent muscles between the arm and scapula. Finally, we've addressed the long head of the biceps, which is also heavily involved in shoulder pain. I hope you liked it, that you can share it with people who need it, and that you come back to my channel occasionally to join me and keep improving your quality of life. Vedi friends,